I'm scared to death right now. Mister's blood pressure is high, and he's very cold. He's never cold, but the air was on low, so. But he's in the bathroom now. I'm just documenting. It was 159 over 110, I think. Not good. I'm scared.
Okay.
Sorry. Hey.
Hi, how you doing?
Here.
Me too. Cold. If I drink anything, like if I drink a sip of that water, when it's going down, I just get really cold, and I can feel like the back of my spine, like it's going down. I get like if I just do my head like this, there's something that goes from the lower back down here all the way up, and then it gives me like a headache, kind of. The same thing started happening, like if I eat something, as soon as I swallow it, as soon as I drink that, a few minutes later, I get like a slight headache on the right side. Lost appetite.
Since Friday.
Since Friday, yes.
Okay.
Last night I got up every hour to go to the bathroom. Like every sip of water I took, it just went right through me. I have very dry mouth, so I want to drink something all the time. And I noticed my feet, they're not tingling, but it's almost like my socks are too tight, and it's just before they're gonna start to tingle, like just before.
Okay.
And when I woke up this morning, my back is actually worse. I lost 3 pounds from last night. I got on the scale, and I got on the scale this morning, and it was 3 pounds. But I would assume it's water because I just kept going to the bathroom all night. But I have lost weight.
So you lost 3 pounds since Friday?
No.
Overnight.
Since last.
Okay. And you had the same amount of clothes on, same
Yeah.
scale?
Yeah. I
Okay.
usually just get blood flow down.
No, it's okay. Talk to me.
Yeah.
Some of these things you're saying, like the back pain and stuff, the neck and back, when something else is going on in the body, there can be an element of tension and pain and so on and so forth. You know, there's a dozen different things. There's different things going on.
Yeah.
So what we do is you give us all the good information, and we try to meet out.
Okay. Yeah. Chest pain.
Oh yeah, that's
Yeah,
important.
just weird random chest
And how
pains.
long has the chest pain been going on?
That's been for a while.
Yeah, that's been for probably a good month, off and on. But like I said, when I hone in on it, then it seems like it goes away.
Right.
There's still not reason to ignore it though.
Right.
Right.
And if it makes any difference, I just want to say that
Do you have a primary doctor that you see?
I had a couple, but I just got a new one. I had an appointment today at 2:00, but I felt I needed to come here because
Yeah. We'll check you out.
Yeah.
You know, just because you've got a number of things going on that have been going on for a little while, so I'm curious if there was any other workup for anything in particular. You mentioned going to physical therapy.
Yeah, that was. And I usually always have an appetite, so that.
Oh, sure. That's fair. I get you.
Yeah.
I just want to get your temperature too.
Okay.
141 over 98. When I did the first one, it was higher, so each one has gotten lower.
Okay.
So there's an element of stress. Do you know what I mean? Like we always do a repeat.
Okay.
And we'll do another one probably within the hour just to see. A lot of times when people come in and they're giving their
Sorry, Barney's right in there. Hi, I'm Dr. Good to meet you.
He's been giving me a number of things that have been going on.
Oh, so okay, so it's complicated.
Yeah, we started off with the narrative, and then he's kind of putting it all out there so we can make good decisions for what we need to do.
Okay.
So I'll let you, if you can summarize what you just told me.
Okay.
That'll be helpful for her.
Okay.
Okay, let's hear it.
Okay.
Were you sweating?
No.
No.
I wasn't sweating. No.
Okay. Go. Okay.
I'm sorry.
Don't be stressed. We're not
Because
pressuring you. We got time.
When I drink anything cold, like if I drink a sip of that water, I get cold, and then that makes me. It's not a real bad pain, but it makes me like if somebody shined a flashlight in my eye. You know, it makes me want to do this. And I get the same feeling when I eat. Like, what's going on? So that's.
And are your hands and feet like really cold? Like cold? Have you noticed they're cold?
Not cold to the touch so much, but he gets uncomfortably for me cold, and because that's out of character, and especially and with me going through periodic hot flashes, I know the difference. And when he was just uncomfortably cold, I didn't like that at all.
My mouth is always dry, so I want to drink something.
And it's actually been
Not
consistent for a couple of days.
Yeah, it's been consistent with the appetite. Like I probably go the whole day and not eat, and then if I put the food in front of me,
Yeah.
I take a bite and I start feeling like I don't even want to eat it, but I force myself to eat it, and then I get that slight thing there. But then after that, I kind of feel okay, but my back is still.
So the back is the worst of the pain.
Right now, yeah, the back is. It seems like everything is stemming from down here. So it's like, yeah.
Okay. And there was no injury or anything.
Not that I know of. Like I told her, I have a strenuous job, but I don't.
You do like. And what about your thyroid? Has that been checked on recently? Like, what treatment did you have for that?
Well, that was a long time ago, and they just told me to watch it. They didn't give me any medication for it or not. But that was something they found when they were, because I had a bout of pancreatitis as well years back. But the thyroid is something they just found when they were doing the test or something else.
Okay. And do you see a regular doctor?
I just switched to a new doctor, and I had an appointment for 2 o'clock today, but when I woke up the way I felt, I felt I needed to probably come.
Who were you supposed to see today? Is it somebody through?
Yeah.
Okay. Alrighty. Yeah. Okay. Well, this is
I mean, that's the most I can tell
a
you.
little tricky. We'll try to put it all together here.
You can kick his shoes under there. I don't want any of you guys to trip over his shoes.
And have you ever had anything like this happen before?
He'll be sick.
Did you ever have an MRI or anything? No. Okay. Open your mouth real big for me. Do you have family history of diabetes?
Yes. And I actually checked my blood sugar.
Oh, you did?
What's going on? Yeah, it was at 110.
Oh, good.
Yeah, my dad's a diabetic.
Okay.
And blood pressure too.
And blood pressure I checked too. It was high, but
Yeah, it was really, really unnecessarily, uncomfortably high
it
last
was
night.
like 160 something.
Okay.
So I didn't know if it was
Over
either
110.
or not. Yeah, over 110. And then when I checked it the next morning, it was down to like 140 something.
Okay. Take a couple deep breaths from me. Blood counts look good, no signs of infection. I checked your thyroid, I checked your liver, kidneys, like metabolic profile, blood sugar, everything's coming back looking okay. X-ray looks good here and here, stable. So if the urine shows nothing, I think I might add on a couple of CT scans, just because we're not just shotgunning it here, But I wanted to let you know, so far so good, but I might have you hang and just do a couple more tests just to do as much as we can while you're here.
That's why I'm here.
Okay.
I
All
appreciate
right.
it.
Sounds
Thank
good.
you very much.
I'm not like this towards the other thing. Because I take a big cup of coffee. Yeah.
Was that a double or not really?
No, it's my normal shift, 11 to 11. Yeah. Today and tomorrow, 11.
Oh, really?
Yeah.
Get it in.
Trying. I just came back from maternity leave, so.
Oh, congratulations.
Thank you. Felt like I never left.
You have a girl or a boy?
It went by so fast, a girl.
Oh.
Was your first job?
My third. Yeah. All right. They'll be right with you guys, okay? And then when you're done with your test, I'll see you back in your room.
Okay, thank you.
No problem.
Okay.
Is the X-ray dye that makes you feel warm inside?
Yes.
Do you have an allergic reaction to it?
No.
You're not getting that today. Ma'am, this is going to take about 5 to 7 minutes.
Okay.
So I'm going to have you step on the hallway.
Okay.
Door on the left is the women's dressing room.
Okay.
There's a bathroom in there.
Okay, thank you.
We're getting close. I see Ronald.
These are big landmarks.
Yeah.
I have access to your records. I think
Okay.
you've seen some Yashin or someone.
Mm.
But you know what you want to do is, I'm going to ask you one question right now. Is there anything acute bothering you at this moment?
Yes, my lower back.
And that's what you went there for.
That's the thing.
And what did they tell you?
They said they wanted to check the organs. They wanted to check other stuff.
What did they do for you
Well,
over there?
they did a
Besides the blood work?
CT scan.
What did they do? CT scan?
CT scan.
Today?
It's on the paper.
Oh, okay. And what did they tell you?
They didn't find nothing with the CT scan. They didn't find anything with the abdomen scan. They didn't find anything with the chest X-ray. They said my
CT brain, you have to see that, the chest X-ray.
blood work looked good.
So what did they tell you end of the day?
They told me to come here and follow with you since I already had an appointment, and maybe we can pinpoint something to that.
Okay. When was the last time you had a physical? I'm going to lead you through this, okay? Because I'm going to lead you through all these questions, and I'm not going to give any recommendations today because I'm going to go back and see what they did. You know, but I don't want to duplicate things. I should have probably give you a call back on Thursday. You know, because tomorrow is a good day for me to read. That's the day I don't see patients. I read everything together, go back and look at some of your old records, see what has been done, so I can make some sense out of it. But I'm going to lead you through some symptoms right now. Any problems with your eyes, nose, throat?
No.
So the last time you had a physical was a while ago?
Like last year. It should be in there. Wellness visit or whatever.
Yeah. And the only medicines you're taking is nothing else, correct?
I'm not even really taking that.
Okay, now what about this thyrotoxicosis? Somewhere they put that you had thyrotoxicosis. You had anything like that?
I don't know what that
Like
is.
a hyperthyroid or anything?
Yeah, they found that years back, but they never gave me anything for it. They said it wasn't, just keep an eye on it.
So right now, you've been labeled as okay, right?
Right.
So when was this diagnosis of thyrotoxicosis made?
That probably
Years
was
ago, right?
like at least 5 years ago.
Any history of diabetes or anything that you're aware of?
No.
Do you smoke?
No.
Any coughing, bringing up any phlegm, any wheezing, chest
No.
pain, shortness of breath or anything like that?
Chest pain every now and then. It just is random.
And what have you done about it?
I went to the doctor and they didn't
What did
find
he do?
anything. They did the same things as like at ER.
How long back was this when you went to the
This morning.
No, not this time. When you went,
For the
when
other
you went
chest
to your
pain.
doctor with chest pain.
That probably was maybe 3 years ago. I have to guess.
Did they do any heart tests on you?
Yeah.
You had a Doppler, carotid Doppler. Dr. Shaw did. All right, we'll have to look at that. So we'll review that. But they told you everything was okay?
Yeah.
All right, right now, do you have any chest pain?
No.
Do you do any exercise?
Yeah, exercise.
What exercise do you do?
I do like a lift.
How often do you do that?
Probably 3 times a week.
Any stomach problems, nausea, vomiting, abdominal pain, bowel problems, any weight changes, any blood in your stool, any black color stools?
My stools are loose, and this morning they were floating.
Is that how it is normally or
No.
something?
No, normally I have solid stools.
So it was just a variation today, correct?
Yeah.
Any problem with urination?
Like I said, I was in frequent urination. Had to get up every hour last night.
Okay, how's it now?
It seemed to be okay now. But I haven't really
Drank any
eaten
water.
anything too much.
Yeah.
Any bleeding tendencies, anything that you're aware of?
No,
Any skin problems, any joints that bother you?
my joints bothered me for years, and I've been in here for that. And
It's mainly the back pain, right?
right now it's the back pain, and like I said, I think it's something with a nervous system or something.
How bad is the back pain?
It's about a 3 on a scale to 1 to 10.
What makes it worse?
Yeah, I can't really say. Like, I'm sitting here now, and sometimes it bothers me, and then I get up, walk around, and it's okay.
Okay. Is this something long-standing or it comes and goes, this back pain?
It's there, but I'm saying
It's been there for months? Or?
No. This just started Friday night, Saturday. Yeah.
Any history of kidney stones?
No.
How is your stress level?
I guess it's normal.
What kind of work do you do? Alright. Just let me see here. See, you know what they did? They did what what I would have done, but did they tell you anything about the urine? You had a little blood in the urine. Did they tell you that?
No, they didn't tell me anything. They asked me, but I told them I don't know. They have the test.
I'll have to put this whole thing together. I'll probably
Okay.
give you a call. See, do you see this here? A little blood in the urine.
At 3.5?
This one, 3 to 5. Now this 0 to 2. So it is a little bit off. I can't make a big deal about it. They checked your pancreas, that's okay. Your rest of the liver, kidney was good. Your blood count was good. So you know what? I need some time to put this together. I want to look at the CT scan, everything put together, see what's going on, and see what has been done before, by your other doctors. Look at your heart test, put everything together. You'll hear from me on Thursday, right? I'll probably put it. Listen, I can start from scratch all over again, but that's a real waste of money.
Mm-hmm.
You won't do that.
Yeah, it is.
So what I'm going to do, I'll just do a brief examination on the back, no recommendations. We'll read this all together. You'll hear from me or my nurse on Thursday. We'll go from there.
Okay.
And what I like to do generally, if a person has, multiple complaints, see, you can't, weird things do happen,
Yeah.
but you can't be hit with lightning twice.
Right.
It can happen.
Yeah.
So what we want to do, you're gonna have 5 different illnesses coming on at the same time. So you want to link it together and see, where the issues are.
Okay.
Does he snore?
No, well, sometimes. Yeah,
Does he
sometimes.
sleep okay at night?
Lately, it's been disrupted.
Does he thrash around in his bed?
He doesn't thrash around, but he may toss a little, but he doesn't. Yeah.
You get up in the morning feeling pretty fresh?
Was it?
You get up in the morning feeling pretty fresh?
Not all the time, because I don't get a whole lot of sleep, but.
Lift this up for me, straight up. Lift this up. Bend your knees. How's the pain now on a scale of 1 to 10? Where would you put it?
It's still about a 3.
What makes the pain worse?
I think sitting down, because then
Sit up for me like this.
I feel it in my butt too.
Like if you do like this, does it hurt when you got up?
Not that bad.
Let me just bend forward, touch your toes for me. Straighten up. Do this for me. Go this way. The other way. Do this for me. This way. Alright, so let's talk about the back pain, okay? When you have a back pain, you can go from the back. You talk from the outside in. Okay, you have your skin. Skin looks good. Muscles. Muscle, the common spot, the back pain. You didn't fall down and didn't have any football injury to say, hey, you fell down, you broke your bone.
Right.
You wouldn't be able to do any of this. That will go on the insides, okay? Inside the skin, your entire belly. So the insides look good except for a little blood in the urine, which I want to go back and look at some of your old urines and see what it is. So they pretty much have done what needs to be done. Right? I know they did a CT of head. Head has got nothing to do with the back pain. So they did a CT scan, everything has been checked out. Now what else is there on the inside? You have your gut. Now if you told me, Doc, I'm having cramping in my belly, or I'm having diarrhea or having some blood in my stool, then it is, oh, we need to put a tube from here and from there. But you got no gut problems, your blood work is fine. You're only 44 years old, so we're not putting no tubes in you. The only area I might go looking is the blood in the urine, okay? But I'm going to look at some of your old urine and see what it shows. If that is still there, this may just be an incidental finding. Certain people just, have what is called microscopic hematuria. Just, you see it on the microscope, you can't see it with the naked eye. That may just be normal for you.
Okay.
But it could be the cause of your problem, the pain. We got to check it out. So we may need to have someone look up the P area and see what's going on. But before I do that, I got to look at anything else.
Okay.
If the P area is fine and all the gut on the CT scan is fine, there's nothing to worry about. Then there's a muscular pain. And if I look at you, your posture is not the best. You are a little bit.
Oh, I know my posture's not the
So
best.
then we may need to do. I can go show you some exercise. I'll give you some brochures and all that. But before I kind of put my hand in my mouth, I want to read everything, see what it is, and then we'll give you a call.
Okay, that's fine, but fair enough. But like I said, my concern is, it feels like something that's got to do with nerves. So, you said muscle, but I don't know if that's also because.
See, let me tell you, if you're talking about nerves, your range of movement wouldn't be this good. You had a full range of movement, all right? Now, what they did will not show the nerves.
Right.
But you gotta have, the movement is worse with pain. You have shooting pain down your legs. There are different symptoms that you see in the back pain. You wouldn't be able to pop up like this from a back pain. So if this is not a nerve pain, now you want, I'll do the test. It costs you a few $1,000s. But yeah, that's what, nothing is cheap. But see, that's where we use our common sense.
Yeah.
When I want to treat you, I want to treat the way I treat myself. Or the way I would, treat my own family members. I'm not going to just go do an MRI. I'll do an MRI, I don't care. You pay for it. But if I was you, I wouldn't do it because you know what? Even if you have an abnormal MRI, we're not doing nothing. You got a full range of movement. You only go into someone's back when you can't bend or you have a risk, and then you do thinking about surgery or something. You're not going to do surgery just like that. A man who's got a full range of movement. So there are a lot of baby steps that need to be done before you go to that.
Okay, I mean, that's fine.
If I was to send you to a surgeon today with a full range of movement, you're probably going to say, is he a doctor or is he a goofball? He's sending guy with a full range of movement. Moreover, let's say example, doc, I don't care, I want to do an MRI. I'm just saying, okay, the insurance ain't going to let you do it. They control everything. So
Yeah, they
crazy.
do. Yeah.
Tomorrow when they go to quality control and they look at me, they say, Dr. Martin, are you in your head or something off with you? This man's got a full range of movement doing an MRI. What's wrong with you? So there are a lot of baby steps. So I'll guide you through that.
Okay, that's fine. Like I said, my concern is like I hear people.
Let me tell you, based on what I know a little bit about you, what I read about you, what I saw, there's nothing out of line. The only thing is the blood in the urine. I need to look into that. But sometimes, say if you've done our workout, you can see a few red blood cells in the urine, not with the naked eye, but with a microscope.
But in terms of recovery and it getting better,
What?
is it a matter of time, or are there things that he can do, or is that what you were referencing when you were talking about the exercises? Like, is there something that he can do or not do, not to enhance?
At the moment, he can do what he wants because he's got a good range of movement. Okay.
Can't stand you.
He's got a great range of movement. If he wants to stand on his head, I'm not going to tell him no.
Okay.
But I can tell you based on many years of practice and many years of this, his pain is I could be wrong. 99% is the pain coming from his muscles. If you go look up, Google, commonest cause of back pain, he'll tell you the muscles are living. Because many of us, we work in weird postures. Right?
Really?
I'm a lot of work. But if you go inside, what else is there? I'm not checking his uterus, he doesn't have a uterus. I'm not checking his brain, that doesn't cause pain here. I'm not checking his heart because that doesn't cause. If you go by what is here, I went through the whole thing, your muscles, ligaments, your abdomen, the insides of your abdomen, and your kidneys. They checked everything out. That's what they did a CT scan. The only thing they saw was a little blood in the urine, which I think is an incidental finding, but I gotta go back and look at it. If I take everything out, the only thing left is your muscles. And
Well, you got your spine, your spinal cord.
Yeah, that's what I meant.
Yeah, right.
That's
So-
what I meant, your back.
Okay, so.
But if you have a spinal cord problem, unless you told me, Doc, I had a football injury, someone whacked me at the back, you have no radiating pain down. I'll give you an example. If you want to look at this picture, you'll understand what it is. If you have a disc or something. If you hit any of your nerves over here at the back, understand? I'm sure you know a little bit about electricity, right?
Yeah.
If your circuit breaker goes, the lights go off, right? In the area which trips.
Right.
Right? So if you hit any of your nerves, which is like your circuit box, you're going to trip some of your nerves, which will cause you to have shooting pain down. You understand? You got a full range of movement. If you have a full range of movement, you got lights in your house and you're saying my circuit breaker is gone, how can it be all your lights are on? So, we have to use some deductive logic. The nerves are very, very, it's like mathematics. If this nerve is, if you're numb over here, you track it down, it's this nerve that's wrong. So, you have a full range of movement. And if you have a diminished range of movement, then you start thinking about a pinched nerve. But this is the initial preliminary workup, but I will look into it a little bit more.
Okay.
So you will probably hear from me, what's your day off? So you want to do this, just set up a physical for Friday? This Friday, so you can squeeze you in, and then we'll have a full team check then.
What is a physical?
Or top to bottom, we'll see your headache and everything, read everything, see what goes on, whether we need to. Today's appointment is predominantly for the back. If you want, that's up to you.
But if the physical is not going to move us to the next steps of healing
Because I
this
don't care
thing.
about a physical, I care about the way I feel right now.
Yeah.
Okay,
And,
so-
and if I gotta go to work, it's not gonna.
Yeah.
So let me tell you
That's
one
what I'm
thing,
saying.
based on what I've seen, if back is your main issue, if I've seen on the back, you pretty much they have done everything.
Okay.
The only thing left is the blood in the urine, which I think is an incidental finding, which I have to review.
Okay.
And I'll look at some of your previous urines.
Okay.
If you go by the next logical step right now, you need you can either exercise the ones that I gave you, or you can go for physical therapy, which they will do, but they charge a little bit more.
Yeah.
If you want, so doc, I'm going crazy, I want to find out, I can put a request for an MRI. But if they approve it, number two, and it's expensive. If you ask me, doc, if you were in my shoe, would you do it? No, I would not do it, not right now. The only time I do that is if you have a decreased range of movement, or the pain is shooting down to your extremities, or you have a restricted range of movement in your legs, or you've had 6-8 weeks of exercise therapy is not getting better, then you go for it. Because otherwise, or if you're going for some surgical intervention or you're planning to inject the spine, that's when you need
I
it.
get all that, but like I said, I have other symptoms too, and like I was telling her, I told her else, that didn't happen. That happened since Friday, so it's like some stuff is different.
Okay, so let me tell you one thing. We have to connect mathematics as a science,
Okay,
right?
I just want you to understand that all my stuff, it just seems like
So-
you're just focusing that I got a muscle
No,
back.
okay, but see,
And I don't mean to cut you off, but I came here before and saw another doctor years back, and I had some other issues going on, and I told him, I got a pain back here, but also something up here, back pain right away, sent me to physical therapy. But that wasn't my issue. I've had.
so that's why I'm throwing the option to you,
Yeah.
to get a physical, because you need to get a whole thing checked from top to bottom. See, I'm giving an example, just trying to be stupid, you can't do that.
Yeah.
That's when you need to check the whole out completely, but I gave you the option for a physical, but
No, I mean, I just came from ER though, and I'm just trying to find out what's different with the physical.
see, physical is, we do
What-
check, see, when you go there, they're focused on your back.
Okay, so what is the physical,
We put everything together from top to bottom. You told me
which
this
is
is
what?
getting
Okay, blood test and what else?
a full examination from top to bottom, eyes, nose, throat. Now you're telling me you got a headache. Now you're telling me you got abdominal pain. You're telling me you got. So we're going all over the place.
But that's what's happening.
Yeah, so then you need a
And it
physical.
all happened since Friday.
Then you need a whole examination. You understand my dilemma. You're coming here. I'm predominantly for back pain. That's what it was, and that's what was there. And if you turn around to me, doc, I'm having a headache. I'm having abdominal pain.
But I didn't tell. That's what I'm saying. I didn't tell them I just had back pain.
Yeah,
That's
all
not
of
why I was
those-
coming here was just for back pain. If they put that in there, then they entered it wrong.
Because see what happens. Let me tell you. If you have multiple complaints, just
Yeah.
give an example.
Okay.
The way I would treat it is get a top to bottom, get the whole thing checked out, make sure you have a whole, be checked out completely.
Okay.
That's the way I would do it.
Okay.
Because see, if you come and tell me, doc, I got a sore throat, alright? Very easy, look at your sore throat, take care of it, done. Doc, my knee's hurting, take care of the knee, done. But when you're telling me you're going from, this
Yeah.
to abdominal
Yeah.
pain, to back pain, to headaches,
Right.
feeling tired or whatever, then, you're going to multiple organ systems. I have to put that all together. You cannot just say, oh, go get this done. So if you want, it's up to you. If you want me to focus on your current symptoms, let me read the reps and get back to you. But if you ask me as a doc, you got multiple complaints, get the whole job done. So you know where you stand as a clean bill of health. Otherwise, what's gonna happen is you're gonna get bits and pieces. But right now, you know what, wait for me to give you a call.
Yeah, let's see
Yeah,
what
let's
we
just see
get
what-
And let
called
me put it all
Thursday.
together. I'll
Yeah.
read some of your previous notes from your other doctors and try to make some sense out of it.
Okay,
All right?
Fair enough.
thank you very much.
Unfortunately, medicine is, it's quite, let me tell you the two things. First and foremost, it's very expensive. I don't like to just go and order tests, but I read the records. Because if I'm in your position, I know how much it hurts. Number two is, medicine, like I told you, you have to put everything together. You cannot just say, oh, the head is separate and this is separate. It's kind of unlikely to get 5 illnesses at the same time unless you're really unlucky. So we got to put that together.
Okay. I'll let you
I'll let
know
you know,
Thursday.
okay?